Welcome everyone to the presentation titled Challenge and Opportunities for Hepatitis C Elimination Among Young People Who Inject Drugs in New York City. I will speak of our findings that indicate a relatively low RNA seroconversion and genetically linked hepatitis C infections. As most of you know, a new generation of young people who inject drugs face persistent viral threats to hepatitis C infection. Young people who inject drugs tend to associate and inject drugs mostly with other people their own age, despite the fact that a smaller proportion interacts with older PWID. And beyond hepatitis C antibody prevalence, we need to know what is the chronic infection rates and understand hepatitis C transmission links. As part of an ongoing stage-safe studies, the behavioral intervention to prevent hepatitis C, we screen young opioid users ages 18 to 29 in New York City, most of whom were referred by peers. Between February and December 2019, we screened and collected DBS from 387 young people who inject drugs. Screening procedures included age verification, hepatitis C antibody testing, and dried blood sample collection. DBS were sent to laboratory for RNA testing and GHOST phylogenetic analysis. GHOST stands for Global Hepatitis C Outbreak and Surveillance Technology. Is a CDC program that runs a phylogenetic analysis from samples throughout the US. The results of the analysis indicated that 26% of the screenees, 101 from the 307 screen, were hepatitis C antibody positive, of whom 52% were RNA positive. 52 of those RNA samples were deemed viable for GHOST phylogenetic analysis, and the results indicate a whole quarter, 27% of those RNA positive individuals were genetically linked. 4 separate transmissions connected 4 pairs, 1/5 transmission linked 3 individuals, and additionally 3 individuals were genetically close to 3 of those 4 pairs. This is another way to look at the data. The overall screenees were 387. Of those, 26% were antibody positive, 13% were RNA positive, and 4% were presented genetically linked infections. This is the genotype distribution. 65% were 1A, 31% 3A, and 1 individual was 2A. And interestingly, another individual presented all 3 genotypes, 1A, 1B, and 3A. This is the GHOST network. You can see here the 4 pairs and these 3 individual link network. And the phylogenetic tree is interesting in that indicates those links, pairs, and the threesome. But additionally, there are 3 individuals linked to them genetically, but not close enough to indicate a direct link. In conclusion, young PWID of the sample in New York City, a quarter present chronic hep C infections that were genetically linked. Phylogenetic testing could provide critical understanding of hep C infections and identify hotspots among networks. And clearly our data indicates that expanding RNA testing and treating those with chronic infections could drastically reduce hep C incidence and transmission in this high-risk population that could certainly lead to hepatitis C elimination. Thank you.